Thank you, Mr. Speaker. Ladies and gentlemen of the House, when the federal government passed the Affordable Care Act several years ago, it mandated that states create qualified health plans. And when those qualified health plans were created, there was a specific set of mandates set with those for mandated health benefits. Those health benefits that were set at the time when those qualified health plans were created were meant to be the plans going forward. And we often in this body talk about additional mandated benefits and health plans and have discussed those through the years. What the Affordable Care Act also did was it created this provision for defrayment of cost related to additional health mandates that go on the books after the qualified health plans were set up. And what that does is it creates a system where the state budget would be responsible for those new mandates that we add related to those qualified health plans. So if we pass a mandate, it has a cost. Instead of that cost being passed on to the insurance companies and then down to the actual insureds, the insurance companies will be sending bills for those benefits to the State Department of Insurance for us to pay out of the budget. This bill will address that issue to make sure that there is a mechanism in the statute for those payments to be made, but also to suspend health mandates that trigger defrayment so that we're not on the hook for those additional health benefits that have been passed or would prospectively be passed in the future. Mr. Speaker, I'd ask the clerk please report House Committee Substitute 1.
Clerk, please report.
House Committee Substitute 1 to House Bill 186.
Gentleman from Edmondson.
The original bill was very short, just a couple of paragraphs. Once we got to working with the Department of Insurance, we built a much more robust bill around this issue, and we actually cleaned up some other things too. We cleaned up things dealing with fiscal impact statements on health benefits and on health benefit mandate statements. We also created a defrayal statement, so if someone files a bill that has a health mandate or a new health benefit that would be added, that gets sent over now to the Department of Insurance to weigh in on whether it would trigger defrayment under the federal provisions, so that we know before we pass those whether they would have a direct cost to the state budget or whether they would not, what an estimate of that cost is as well. So again, what this will do is it creates a more robust set of rules around this and how it works, how those payments would get made if they were necessary. We do have two mandated benefits that we have passed since the QHPs went into effect that the Department of Insurance is currently tracking, bills that were passed last year. This would suspend those, and again, any prospective bill that comes later related to mandated health benefits that would trigger defrayment until the federal government removes those defrayment rules on those mandates. That goes over most of what the bill will do with the committee substitute. The one other thing I will bring to everybody's attention, when we have gotten these health mandate statements in the past that tell us what the cost is going to be, either per member per month or across the board, we have had kind of a hole in that as well, because we don't normally get data on what the cost is in the Kentucky Employees Health Plan. We're also going to create a new fiscal statement that the Department of Personnel would have to submit to us on those so that we would know what the cost of mandated benefits would be on the Kentucky Employee Health Plan as well. This is truly a bill that's about being fiscally responsible, making sure that we're not getting the state on the hook for dollars that we don't know exactly what they're going to be or how they will work in the future. And it will, again, suspend those mandates if they would trigger defrayment, either prospectively or retroactively as well, when those policies are renewed or issued in the future.